Hello, and welcome to this podcast for improving joint and muscle mobility. My name is Cindy Quinn, and I am the Blue Cross and Blue Shield of Texas Wellness Coordinator for the Texas A&M University System. Thank you for joining me today as we discuss ways to work with joint and mobility pain. The information presented today comes from the National Institute of Health, Center for Disease Control, and the Arthritis Foundation. As a reminder, this information is for educational purposes only and is not intended to substitute for advice from your physician or healthcare team. Hopefully, with today's podcast, you will find 1 to 2 tools to put into practice which can lead to positive results and improved wellness for you. If you are on the Blue Cross and Blue Shield of Texas medical plan through the Texas A&M University System, you have access to joint and muscle wellness programs such as Hinge Health, Ergonomics, and Well on Target. Well on Target is your gateway to access an array of personalized tools and resources to help you set and reach your wellness goals. Blue Cross Blue Shield wellness partners Hinge Health and Ergonomics are proven to provide personalized care to address your joint and muscle pain at no cost to you. So let's begin our discussion by talking about the causes of joint and musculoskeletal pain, or MSK. Many causes of joint and MSK pain include bone fractures, disease, overuse, poor posture, sprains, and direct blows to muscles, bones, or joints. Some conditions that increase your risk for pain include arthritis, fibromyalgia, or tunnel syndromes, such as carpal tunnel syndrome. Pain from these conditions and causes affects your bones, joints, ligaments, muscles, and tendons. Musculoskeletal pain can be acute, meaning it is sudden and severe, or the pain can be chronic, which means it could be long-lasting. You may have localized pain in one area of your body, or it may affect your entire body. When we define pain, we want to pay close attention to both the severity and persistency of the pain. Severe joint pain is defined when an individual rates his or her pain as 7 or higher out of 10 on a scale of 0, no pain, to 10, as bad as it can be. Persistent pain is when an individual reports having pain of any severity on most or all days in the past 3 months. A 2019 National Health Interview Survey found that 50.2 million adults reported pain on most days or every day. The most common pain locations were the back and hip, knee or foot pain with reported limitations in daily functioning, including activities of daily living and social activities. Those with chronic pain missed more work days compared with those without chronic pain. So let's consider for a moment how MSK conditions do affect the workplace. So work-related musculoskeletal disorders, also known as WMSDs, are conditions in which the work environment and performance of work contribute significantly to the condition, making the condition worse or persisting longer due to the work conditions. In many work environments, we are sitting about 7 to 8 hours a day. For office workers, that number skyrockets to an average of 15 hours per day, especially if you have a long commute. Sitting too long causes our joints to stiffen and muscles to shorten, causing stress on the joints, which then increases the pain. Prolonged sitting is also linked to an increased risk of obesity, high blood pressure, diabetes, heart disease, and, specific to today's podcast, poor joint health. Maybe you are one of the 50 million adults reporting pain. So let's discuss things that you can do and the resources available to you to decrease your pain. First, find ways to increase your physical activity. Physical activity is key to manage and reduce pain, which decreases the likelihood of activity limitations. Now, while this may sound counterintuitive, Low-impact exercises like walking, biking, and swimming reduce the pain and increase range of motion and flexibility. There are several physical activity programs designed to engage people of all ages and fitness levels to improve quality of life. For example, Walk Across Texas is a free 8-week walking challenge designed to help Texans be more active and establish the habit of regular physical activity. Members of the Texas A&M University System's Blue Cross and Blue Shield of Texas medical plan can also access Hinge Health, Ergonomics, and the Well on Target wellness programs. Hinge Health provides low-impact exercises prescribed just for you and one-on-one support from your personal health coach or physical therapist to help you meet the goals you care most about. With the Hinge Health app, you can do your sessions anytime, at home or anywhere you're comfortable. Well on Target incentivizes your wellness journey by allowing you to connect activity trackers, participate in physical activity education and challenges, while getting support from your Well on Target coach. Ergonomics provides in-clinic patient care to identify the root of your muscle and joint pain while treating it directly at the source. The second thing we can do is pay attention to workplace ergonomics. Ergonomics is the science of fitting workplace conditions and job demands to the capability of the working population. Many of you might spend a large part of your day at your workstation, and therefore you may develop ergonomic-related problems resulting in musculoskeletal disorders. There are many benefits to using proper ergonomics, including fewer injuries and increased morale. So let's talk about some simple things you can do to set up your workstation for success. So choose a chair that supports your spinal curves. Adjust the height of your chair so that your feet rest flat on the floor or on a footrest, and your thighs are parallel to the floor. Adjust armrests so your arms gently rest on them with your shoulders relaxed. Place your mouse within easy reach and on the same surface as your keyboard. While typing or using your mouse, keep your wrists straight, your upper arms close to your body, and your hands at or slightly below the level of your elbows. Consider the use of a standing or sit-to-stand desk, making sure there's clearance, though, for your knees, thighs, and feet under the desk when sitting. Place your monitor directly in front of you, about an arm's length away, with the top of the screen at or slightly below eye level. If you notice pain in your neck or shoulders during the day, we've got a couple of simple joint mobility exercises that you can do right at your desk. First up is the neck flexion stretch. This exercise will help loosen your posterior neck muscles and reduce tightness. Number 1, rest your arms alongside your body and engage your core muscles to stabilize your spine. Then draw your shoulder blades back and down. Slowly draw your chin in towards your chest. Hold for 15 to 30 seconds. Do 2 to 4 repetitions of this exercise. Next up, we have standing arm swings. And this is a great dynamic stretch that helps to increase blood flow to the shoulder joints and upper back. Doing this exercise can improve mobility and flexibility in your shoulders and upper back. So stand tall with your arms by your sides. Engage your core and swing your arms forward until they are as high as you can go. Make sure, though, you don't raise your shoulders. Then return your arms to the starting position and repeat this movement for 30 seconds. Don't forget to breathe. I do hope that you found 1 or 2 mobility tools to incorporate into your healthy life this week. Be sure to write them down and then put them into practice for those positive results. Remember to consult with your healthcare team on the best options for you, as well as utilize your wellness benefits that include Well on Target, Hinge Health, and Erasti. Thank you for listening and have a healthy and happy day.